Okay, we're going to talk about diagnosing. Okay, here are the 4 criteria that you need to get the diagnosis. You want to get confirmation that the mother drank alcohol during her pregnancy, but that is not mandatory. You don't have to have that, and there was this belief for a long time that if you couldn't find the mother because she was long out of the picture, long gone, and often the moms are gone because the babies are taken, that you couldn't get this diagnosis. That's not true. If you can identify prenatal alcohol exposure through medical records or through past history of the mom being arrested for alcohol, then you can still meet this criteria. There's also growth deficiency, central nervous system abnormalities, and dysmorphic features, including indistinct philtrum, which is this between the nose and the mouth, this area right here. Kids that have fetal alcohol, you can see it in this picture. 5 is full fetal alcohol syndrome, all the way down to 1, which is normal, okay? And it also looks different in racial categories, so you really have to take that into consideration. Also, palpable fissures. They used to think that kids with fetal alcohol had eyes wider apart. They know now that really what's going on is the eyes develop smaller in size, and they have that kind of overlapping skin that you see there. But the doctors who diagnose this have scales that they're going to use. That's why they need the kids for a whole day to do the diagnostic workups, because they're going to look at all of these categories. So individuals with FAS scored 4 or 5 on this scale. This is actually from the University of Washington FAS Diagnostic and Prevention Network, if you're interested in getting it. Okay, so here we see all of the issues going on. The thin upper lip, okay, upturned nose. Here, this is the one that really gets people. They have what they, one of the things is kind of see that, they call this a hockey stick thing here. And that's real characteristic of kids with fetal alcohol spectrum disorders. Also see that baby finger kind of turned in like that, okay? And ears, see how the ears have like a railroad track effect to them. Now, no one of these features by itself makes you fetal alcohol, okay? It is really a complicated differential diagnosis that really needs to be done by someone trained in it. But these are signs that you can look for that maybe will help you. In this one, they talk about that the child in C actually has features resembling Down syndrome, and they thought that the child in C was a Down syndrome child until they did a chromosome analysis, and what they found is it wasn't, and that this child actually had fetal alcohol. So this is really important, because you may actually be working with kids that have the wrong diagnosis, right? Now, is that always the case? No. Here's some other issues that you see. Now, no one of these is fetal alcohol on itself. I think one of the interesting ones is cardiac issues, abnormalities, and that's pretty common now. They have some research going on now that they're looking at kids with fetal alcohol, and they think the occurrence of the cardiac issues is pretty common with that. Okay, and we know, because we've been talking about it now, that it's a differential diagnosis, and I keep saying this over and over, because every time I do this workshop afterwards, I get a lot of calls from people who are calling me, oh, I think they have this one feature. Do you think that might be what's going on? And I'm really telling you that it's you have to do the whole full diagnostic workup to get this diagnosis. So there are a number of syndromes and disorders where individuals display one or more of these facial features. No single dysmorphic feature is totally unique to fetal alcohol. Growth problems, that's one of the diagnostic criteria, may be related to other things like nutrition and poor health, okay? Environmental and genetic bases for growth retardation should be considered. And the differential diagnosis includes ruling out other disorders and specifying co-occurring disorders. So if there's a mental health diagnosis, and you need to get the complete and detailed family history, and also look at environmental causes for central nervous system disorders. Of course, we talked about losses in the family, and okay, substance use. If you have kids that have fetal alcohol, they are really going to be susceptible themselves to developing alcoholism and drug addiction, and you need to tell them that. You need to tell them that, and imagine you have 2 college kids, and they're both going to college, and one has fetal alcohol, some of the fetal alcohol effects, maybe not full-blown fetal alcohol syndrome. And this kid's binge drinking and this kid's binge drinking in college. The kid with fetal alcohol, there's a pretty good bet they're going to progress very rapidly to alcoholism, versus the other kid who's maybe not, might be able to binge and then pull back and go, oh, I need to drink socially. That kid that's fetal alcohol is not going to be able to do that. And it may be even as extreme as needing to be all or nothing, and really working with these kids about not drinking any alcohol. Okay, and here's some issues around the failure of mental health treatment programs to really recognize fetal alcohol spectrum disorders, although they will often say that they know what they need to know, that they may not follow through for a number of reasons. And then, of course, we just talked about this, kids getting labeled, caregivers, parenting issues, where the parents are just totally at their wits' end, frustrated with these kids, and the kids end up being abused, removed from the home, and then on top of that, the parents are substance abuse themselves, limited fetal alcohol treatment centers. Okay, let's talk about cost. This is the big issue. FAS alone costs us $4 billion. That was in 1998 per year. And an average lifetime cost for each child is $2 million. Now, some of the issues that there are differences in cost between medical services and loss of productivity. Medical treatment, residential care for those age 21 and older, all residential care just for mental retardation, special schools, loss of productivity, all of those things are figured into this. So one prevented case of fetal alcohol saves $130,000 the first 5 years. So that's why when we start talking about preventing this, this is why it's so important. $1 million savings in 30 years. You know, if you have a pregnant client and you ask them, are you drinking alcohol? They're all going to say, no. Me? No. I remember telling my obstetrician, do you drink? Yeah, I might have a drink at Christmas or something. And I was a raging alcoholic, drinking every single day, and he didn't pick up on it. So the way to get the woman to say that she's drinking is say something like, so before you knew you were pregnant, did you drink? Because that kind of takes away the blame. Then they're going to probably tell you the truth, and then you can extrapolate from that. Oh, well, so what happened when you got pregnant? Oh, well, I used to drink a case of beer every night. But when I found out I was pregnant, I stopped. Okay. How many have heard that, actually? I used to hear that all the time at Alpha Home. And another good way to get a woman to talk about alcohol use during pregnancy is put them in a room with somebody like me, and there's a lot of people like me who make it okay to talk about alcohol use during pregnancy, that's going to make them okay. Oh, wow, she's talking about it. And also, if you have parents that you think are abusing alcohol and you're sending them to parenting classes, you don't want to send them to parenting classes where they're going to be in a group of parents who aren't abusing alcohol, because I can guarantee you in that environment, they'll never talk about it, okay? And then they're really going to feel shame. So you really, if you got women that are substance abusers, want to put all those women together in a parenting group, because they're more likely to talk about those issues specific to alcohol use with their kids. Okay, some things that you can do to help these kids in helping them integrate their sensory is simplify their environment so that they're not being overstimulated. You want to provide a lot of one-to-one physical presence. The number of people with an FASD do better when they have somebody physically with them that can help them filter out the distractions and stay focused. In their bedrooms, you probably want to not paint their room purple. There's therapeutic approaches that work with them, individual and didactic therapy, sensory integration therapy, parent support groups, which is, we just talked about that, social skills training, direct learning strategies with tutoring and support. And Dr. Bird, who just talked to us about this, he's really doing all the research on this right now. And absolutely behavioral therapy is the absolute best thing to use with these kids, that you're really using positive reinforcement, making lists, helping them to learn patterns in their daily environment, in things that they're doing, going over it and over it and over it till that neural pathway in their brain is really starting to fire a little better. Okay? Provide instructions one thing at a time. Check for understanding. So when you give them a direction, so Joe, when you get out of school, I want you to come right home after school. What'd you hear me say? Okay, a basic counseling technique that y'all do, right? That's a good way to check for understanding with them. Literal language. For example, if someone says, I'm sorry I got carried away, they're going to think, carried away? Somebody carried you away? So you really want to watch how you're talking to them. And if they're in the classroom, you want to make sure that they're allowed to use calculators and stuff in school. Be aware of misinterpretations. Like, for example, they misread people all the time. So here's an example. He was staring at me, so he must hate me, okay? Because they're really concerned. You want to really address those discrepancies in what they think is going on in a situation and what you actually know is going on by having a conversation. So you got in a fight at school. So tell me what was happening when that went on. Well, so-and-so was looking at me funny. So what did you think that meant? And then help them, dissect that and look at that. Don't isolate them. A lot of times kids get time out at school. And this is really one of the things that really hurts these kids, because they already feel isolated and they already have low self-esteem. And then when they're not following through and have the inappropriate behavior, they're told, go over to timeout and sit in that room. And I've been in some of these classrooms and seen the timeout spaces. And lots of times timeouts are in like the clothing closet where they put a chair for them, okay? And that's really like the worst type of thing that you can do for the kids. Although you do need to remove them from the stimulation, it doesn't need to be like a punishment type setting, because now you not only you've hurt their self-esteem too, and now all the other kids know. Set them up to succeed. Give them measurable goals. Don't isolate them. Don't blame them for stuff they cannot do. Okay, Prevention is the only solution. Talk about alcohol. Raise awareness wherever you are. I hope every single one of you who walks out of here today, if I didn't do nothing else, when you leave here, you know now, right? The blinders have been lifted, right? Okay. So you're all going to take that back to wherever you're at. And you want to make sure that you're having this conversation with any pregnant women or especially young girls of childbearing age that you're coming into contact with. There's really neat posters you can buy. There's a website, the SAMHSA Fetal Alcohol Spectrum Disorder Center for Excellence. You can just put FASD Center for Excellence. I'm going to real quick finish by going back and just talking for a minute about the strengths. Kids with fetal alcohol really often are pretty innocent. They really want to be loved. They're loyal. They're kind to animals. You know, I talked about my daughter and the horses, and when I used to see her interacting with the horses, I was just like, oh man, she's just absolutely wonderful with them. They want to be included. They want to be loved. They're very spontaneous. They're very fair. They just have a lot of strengths, and I know I just spent the whole 2 hours talking about all their weaknesses, but they're beautiful children. They have a lot of potential. We have the ability to get them moving in the right direction by how we interact with them and their families, and maybe even preventing more kids from being born with this birth defect. So, thank you.